Alright, I just want to start by saying that one of my neighbor's fire or carbon monoxide detectors is going off periodically, so that may be heard in the background. To start, yep, there it was. Hello and good day. My name is Erica Bondy. I am here to discuss a particular social problem that I believe is a serious burden to the entire international community. Just to preface with some information provided by the World Health Organization, the social problem that I'm about to detail is responsible for upwards of 3 million deaths, and more than 30 million people are affected by this issue worldwide. It is concerning that the issue has such an international reach. However, I am more concerned with how it is a burden to our local communities. The particular social problem that I am presenting is substance abuse. To be specific, the definition is a harmful use of alcohol, illicit drugs, prescription medication, or other legal substances. Substance abuse really does show no mercy. It is universal. It can and will cause harm, whether you're black or white, young or old, rich or poor, faithful or atheistic. There are factors that arguably contribute to making some persons perhaps more vulnerable than others, but generally speaking, anyone can be affected. So, although substance abuse may be specifically referring to the inappropriate use of an intoxicant, there is a broader meaning, at least to me, for the abuse of substances. There are events that precede an individual's use of the substance, a ladder, if you will, that must be climbed before we reach that specific moment. These events include the trafficking and purchasing of drugs. It involves criminal operations like cartels and gangs that are responsible for the production and distribution of these illicit substances. There's often violent crime with serious injuries and fatalities, all caused by these clashes between rival groups, law enforcement agencies, and civilians. To put the problem in a more detailed perspective, I just want to outline a user and her cocaine abuse. She purchases the cocaine from a dealer in her city. This dealer purchases small to medium quantities from a dealer within the presiding area, who purchases large quantities from a supplier that is located outside of the country. This supplier has connections with an organized gang working near the United States-Mexico border. The gang runs cocaine up through North and Central America from Colombia, South America, where the operations begin. The criminal organization employs a number of locals to work on their isolated farms in a remote village producing the cocaine. And from the first pressed coca leaf to the user who consumes the completed substance, many lives are touched. To connect and clarify, substance abuse, is a social problem because it disrupts the institutions and social order for a community as a whole, while simultaneously disrupting the groups and individuals within it. The user harms himself as the individual. The user harms groups such as family, friends, co-workers. The user encourages criminal activity in his own neighborhood, in turn putting their community in harm's way. If it has not yet become clear, my personal opinion is that substance abuse is something to at least be cautious of. I would compare substance abuse to a dark cloud that hangs over a person's head. We really do not get to decide what the weather is like. And for some people, they have no choice but to be absolutely shadowed by something out of their control. The illness is subjectively upsetting and objectively harmful. It is incredibly difficult to watch a loved one put a substance before you, for them not to seem afraid or negatively affected by the possibility of never seeing you again. Attempting to hold a conversation with someone who is so heavily intoxicated that they cannot even hold their eyelids open is difficult. Listening to a loved one lie to you over and over again about their usage, ultimately making you feel like the bad guy, for perhaps even considering that they are high or drunk, is difficult. It is incredibly difficult to watch a loved one battle each and every day. Substance abuse has these profound effects. They are direct and indirect, physical and mental, social and financial. There are direct effects to the user and those around them, and indirect effects to those around the user and the community at large. It can have a significant effect on the physical and mental health of the user and their loved ones. The illness can be quite costly to the community for which it affects. Rehabilitation, hospitalization, police, emergency medical services, and the list goes on. The social operations of a community can very easily be disrupted by the abuse of substances. Now to kind of get into our now what, our final portion of this presentation, I want to start by kind of getting into some of the examples or modern approaches to combating substance abuse. First one is safe injection sites. So these supervised consumption sites allow for a safer alternative and a legal route to the consumption of otherwise illegal substances such as heroin or methamphetamine. These sites reduce the risk of accidental overdoses while simultaneously providing users with with housing, healthcare, and employment services. There is a reduction in public usage and disposal of drug equipment, a reduction in the spread of disease like HIV, and a reduction in the strain put on first responders. Another approach is are group therapy sessions, like Alcoholics or Narcotics Anonymous. These groups allow for persons suffering to connect and gather a greater sense of community. The meetings act as a reminder to people that they are not suffering alone, and it can surely provide a unique perspective. Additionally, there exists group therapy sessions for those who are family to the users suffering from substance abuse. Al-Anon is the name of the group for loved ones of alcoholics. It provides a safe space for individuals to talk about their experiences as a witness to the problem and how it has affected them. Unfortunately, I cannot provide a very direct way on how students can get involved. This is not exactly a go pick up trash kind of problem. The problem is much greater than you or I. Change is made by our first responders, our politicians, nonprofit organizations, rehabilitation centers, private clinics, hospitals, and so on. Nonetheless, we may provide change in the lives of those closest to us, so this issue requires certainly an immense amount of empathy and understanding. If I can request anything from students, it is to treat everyone like you would your grandmother if she was suffering from substance abuse. Be kind and respectful, listen, provide support and encouragement. If you'd like, if you're interested in perhaps getting more involved, volunteer at your local food bank or the mission. Have conversations with people who are willing, take online classes and read about substance abuse and addictions. Knowledge really is power, and education can certainly invoke change with the correct people and the right avenues. Thank you very much for listening, and consume responsibly.